Hi everyone, this is Cindy. Today we are going to talk about dialectical behavioral therapy. This is the one that really helps therapists to treat difficult clients, such as the ones with strong emotions or even suicidal thoughts and behaviors. So it is a very useful therapy approach. It can help clients not only decrease the symptoms, but also teaching people the skills to manage difficult situations. When I first learned DBT, it was an eye-opening experience. I kept thinking to myself, this is amazing. It's like putting all the useful stuff in this one approach. It's like a therapy goodie bag. In fact, a lot of people claim that they benefit from DBT. Research studies show that DBT is helpful for people with borderline personality disorder. In a 2022 study, they interviewed people who completed 12 months of DBT session. Even though they finished the treatment years ago, it still helped them to manage emotions, improve relationships, and grow as a person. If you experience strong emotions such as anxiety or sadness or anger more quickly, more frequently, and more intensely than other people, then maybe DBT is the answer. So in this video, we're going to talk about what is DBT, what makes it unique, and who can benefit from it. Let's begin by acknowledging that DBT was originally developed for clients who suffer from borderline personality disorder. BPD clients often experience intense emotions. For example, on a scale from 0 to 10, how intense our feelings are. 0 doesn't bother me that much, and 10 is off the chart, the worst distress you can ever imagine. A person without DBT, when they feel angry, they probably are at a 6. It's pretty annoying, can't really do too much about it, but I'm able to manage the current situation. But for people who suffer from BPD, when they feel anger, it's probably 10 out of 10. Sometimes it's even 11 or 15, like throwing things, yelling, screaming. Or when they feel sad, they feel deeply sad, not able to stop crying, not able to get up. Because of those overwhelming emotions, they often struggle with very poor self-image, as well as unstable relationships, which sometimes can cause self-harm or suicidal thoughts or behaviors. Back in the 1960s and 70s, many therapists didn't really know how to treat clients with DBT, and these clients were often rejected for treatment or misdiagnosed with other mental illness. However, this changed in 1980s when DBT was developed by Dr. Marsha Linehan at the University of Washington. She made DBT a little bit more different than the traditional therapy. Instead of just talk therapy, it also combines skill training group, phone coaching, as well as consultation groups. It's like a car with 4 wheels. DBT has 4 parts. So the individual therapy is just like what we usually do, meet with a therapist once a week for 50 minutes to an hour, and focusing on the progress that the client made this week, talk about any setbacks or breakthroughs, basically just checking in on how the clients are doing and how are they applying DBT skills and how to support them moving forward. And along with individual sessions, there's also skill training groups. This is like a support group / classroom setting where several clients sit together. There's an instructor who is also a therapist usually, and they talk about the techniques or tools on how to manage emotions. For example, the topics may include when things get overwhelmed, what can you do? Or when you want to set up boundary, what can you do? Or when you notice an impulse to eat or drink or use, what can you do? And this type of psychoeducation usually helps clients to build their own toolbox. And I will share with you some of the techniques in a little bit. Phone coaching is also called skill coaching because they don't just use phone calls anymore. People text, people email. So it also called skill coaching. This is where the client contact the therapist if they are having a really tough time or in crisis. Let's say the client was being triggered big time and they don't want to wait until the next Tuesday to talk to the therapist. They can just pick up the phone and give the therapist a call. So the therapist can provide immediate support and help clients apply the DBT skills in a real life situation. And the last one is consultation group. This is more for the therapist than for the clients. So let's say this treatment center has 4 DBT therapists, 1 supervisor, 2 caseworkers, and 1 psychiatrist. They all meet together on a weekly basis to discuss the progress, like how the clients are doing, which DBT skills are beneficial, how the therapists are doing, and are there any difficult cases. Then they brainstorm the strategies for those difficult cases. So the purpose is to support the therapist so that the client can receive the best possible treatment. This whole framework, these 4 wheels, really provide client with the tools and support that they need to handle difficult situations. Nowadays, not every setting has all 4 components. For example, the online therapy platform that I worked with a couple years ago, they had individual sessions as well as skill training groups, which is sufficient enough for a lot of clients. And some outpatient settings may have phone coaching options as well as consultation groups. If you are thinking about joining a program or finding a therapist, make sure to ask what do they offer. Let's take a closer look on the skill training part. According to Dr. Marshall Linehan, the creator of DBT, the reason why DBT works so well is because of the skill trainings. These are not skills we typically learn from school. We usually learn it from observing others, like our parents, our friends, or even from characters in a movie or books. They divided those skills into 4 categories. The first key skill is mindfulness. This is where we learn to stay in the present moment, not dwelling on the past, not worrying about the future, not trying to avoid the pain, not trying to seek pleasure constantly. So it's all about fully experience the here and now. And one of the main interventions in this category is called wise mind. So people usually has 2 states of mind. One is reasonable mind. This is where we focus on logic, facts, analysis, and it's all about thinking rationally. And we also have this emotional mind, where when our actions and thoughts are rooted by our feelings, our moods, and it's reactive, it's emotional, and sometimes a little bit overwhelming. So the wise mind is the balance between the 2. It sees the value from both reason as well as emotion. It helps you to use both perspectives. So how should we use it? When you're facing a challenge, the key question to ask yourself is, what would the wise mind do? This helps you to pause, to reflect, and to make choices that align with both of your logic as well as your emotions. Second key skill in DBT is emotion regulation. This means how to change the emotions that we don't want. For this section, we usually start with why do we have emotions? And then we transfer to what are the emotions doing for me? After that, we may start talking about how can I use the opposite action to reduce unwanted emotions. Opposite action is a very powerful tool to help you to reduce unwanted emotions, and it's super simple. So if you feel like isolating yourself when you're sad, the opposite action would be reaching out to a friend or going outside. If you're feeling shameful about something and wanting to hide it from everyone, opposite action would be share it with someone that you trust and see how they react. If you're scared of rejections, the opposite action would be trying to make a strange request the next time when you are at a restaurant and see what happens. So these skills is all about helping you to take control of your emotions and not letting them control you on a daily basis. But what can we do when there is an emergency situation or in crisis? This is where the distress tolerance comes. This skill set teaches you how to survive emotional crisis without making things worse. So when life feels overwhelming and you feel like you can't take it anymore, these skills can help you to hang in there just a little bit longer. Some common techniques include cold water, which is submerging your face in the cold water or hold a cold pack against your face while you're holding your breath for about 15 seconds. And this triggers the dive response. It's a natural reflex that slows down your heart rate and redirect your blood flow back to your heart and your brain. And there's also the muscle relaxation, which is tensing and then relaxing the different muscle groups. These skills don't really solve the problem or the crisis itself, but it can give you the tools to take a break, to stay safe, and to prevent impulsive decisions. And the fourth key skill in DBT is interpersonal effectiveness. This is all about helping you to build a healthy, balanced relationship with others. For example, how to say no when a friend only wants to go to the restaurant that he likes, or how to end a helpless relationship with your partner and don't cause a scene. So if you are interested in learning more, maybe reaching out to a DBT therapist or joining a skill group. If that's not an option for you, you can also check out some DBT skill training books. I've listed in the comment section. Now let's talk about who can benefit from DBT. So DBT is especially helpful for people who struggle with intense emotions. If you feel like constantly experiencing strong emotions without really knowing why, or you want to control your emotions but really don't know how, DBT skill can be really beneficial. And research shows that it's highly effective for depression and anxiety disorders, PTSD, and substance use disorders. If you are someone who wants to build emotional resilience, want to learn a healthy way of coping, or want to improve your relationships, DBT may be a good fit. Thank you so much for watching this video. If you have any questions about DBT or any thoughts, feel free to share with me. I'd love to hear from you. And hope you have a wonderful day, and I'll see you next time.